At the level of a family, ICS undertakes quite a number of interventions. One, we work with the parents and the caregivers themselves and take them through parenting sessions. These are 9 modules that we have developed, tried and tested in East Africa, and they take one module 1 week for the next 12 to 15 weeks, because in between there could be breaks, because they're harvesting seasons, there are seasons when we cannot get the parents, so it takes around 15 weeks to take them through. And most of these parenting sessions, one spouse comes, but there are moments where the spouses should also come together to get through this session. So if, for example, the mothers alone come for these parenting sessions, there would be what we call fatherhood parleys in between, where the spouses would come to also go through the same topics that their wives have gone through, just to ensure at home environment they are on the same page and level of understanding on their parental roles and responsibilities. During the parenting sessions, the parents are also linked to various services, because as we start with the parent peer group, we collect the biodata in terms of their household economic status. We collect services that are their children under 5, have they gone for the clinics, do they have birth registration? So there's a lot of data we collect prior to this engagement of the parents, and that informs us on which kind of services we need to bring in that community. If you synthesize the data, it will tell you many children are not registered in this community, or many children under 5 do not actually go to their monthly growth monitoring clinics, or nutrition is a problem in this community, or incomes are relatively low, so they need access to social protection or cash transfer systems. So the biodata helps us to know which kind of services these families need, and therefore we connect them to all the basic services they require. And 3, they are connected to economic interventions to improve income. There are 2 economic interventions that we connect them to. One is our own agribusiness initiative, which in farming communities, we train parents on modern agronomic skills. We provide seeds and fertilizers on credit and other extra commodities they would need, like solar lamps, modern stoves for cooking. So there's a package that is provided for them on credit. And apart from the agribusiness initiative that we implement, we also connect them to social protection schemes. So National Health Insurance Fund, the Social Security Fund, and the cash transfer program for families that fall within that vulnerability index. So those are the things we do. Train them on their parenting skills, connect them to basic services, and improve their household income and food security. And then we take all the knowledge from our intervention, test it for effectiveness. If it's effective, then we bring this to scale to quite a number of communities, spread our impact or reach across the regions. Yeah. In our parenting program, we have different categories of parents that we are dealing with. So there are single parents, either out of death or choice. And then there are teenagers living with parenting responsibilities. Those are quite a number in the rural areas. It's a big, big number. And then we have grandparents raising their grandchildren because their children have died of HIV or are not there, are in cities fending for themselves. And then we have polygamous families in our communities. I mean, 4 or 5 wives is commonplace in certain areas where we work. And the dynamics of parenting in a polygamous family is quite different from a normal nuclear setting. So those are some of the groups that we are working with.